there. And this topic often makes people nervous because it's talking potentially about death, which is why 17 slides ago it said we're supposed to talk about what? So I want to define what advanced care planning is. It's a process, and it engages patients, their families and caregivers, their medical care teams to discuss the values and desires for making future care decisions. And the objective is to develop a healthcare directive document. This document is intended to form the basis for shared decision-making among the parties, which helps everyone be better prepared to know what to expect over the course of a patient's illness, and whatever the outcome may be. Ideally, healthcare directives will be mobile, which means that they can travel with the patient from place to place and caregiver to caregiver, and they're dynamic in that they need to be able to change as the patient's condition changes. When done properly, this process has been shown to result in better communication and preparation, improved treatment that supports the patient's goals, reduced stress among the patient and their family members, and less intense, lower cost end-of-life care, which is cost-effective. All this leads to peace of mind for everybody. The patient can spend his or her last days as they want. The family support system feels better from having been part of the decision-making process. However, there are still this doesn't happen as often as it should, doesn't happen nearly as often as it should. And there are some barriers that get in the way. For example, following this process is not required. Nobody has to do it. Our culture embraces taking extreme measures to extend life rather than ending it gracefully. The general public is not aware of this process and its benefits, and reimbursement for the time it takes is not consistent. Even in the age of electronic medical records, there are limitations to the technology. Not all caregivers in a given system have access to the right places in the record, and if a patient interfaces with more than one record system, they often don't talk to each other, and these patient records are less prevalent in rural areas than they are in the metro area. Plus, there are some pretty big disparities in the use of advanced care planning among people of color. They will tend to have lower rates of routine primary care and having a consistent health care home, so these conversations don't happen regularly. People of color often experience language and communication barriers in the medical system, and they can have very different culturally based understandings of death. Many people coming from non-Western cultures may not even trust our own Western medical system and the medicine that we practice. So how can we improve this situation and increase the use of advanced care planning? You've already gotten a preview of this as you watch the slides. The first thing we can do is education. These concepts should be embedded in the curricula for medical, nursing, social work, and other professional programs. Community awareness campaigns can be helpful. And as always, collaboration among healthcare professionals is critical. So some examples. Number one would be Honoring Choices. Honoring Choices Minnesota is focused on helping every adult Minnesotan understand what advanced care planning is, and working with healthcare providers to make sure they offer assistance to the patients and that they will honor their choices. Honoring Choices is a collaborative, community-based advanced care planning initiative led by the Twin Cities Medical Society through its foundation. It launched in 2009 with support from healthcare delivery systems and health plans, and today it operates statewide. Another example is the Firefly Sisterhood, which you heard about a little bit earlier from Chris Newcomer, speaking on Objective 5. They connect women already diagnosed with breast cancer with trained breast cancer survivors with similar life circumstances to offer support, guidance, and hope. By having a partner who has been through a similar ordeal, it makes planning the next steps in the process easier and the patient more confident. Many questions can be answered to help the patient and her family. And a third example is Cancer Legal Line, which is led by its founder, Linda Yukonovich, who you will hear from this afternoon. They provide free legal care and information to Minnesotans affected by cancer who otherwise have no access to an attorney's help for the complex legal issues that will impact their health and quality of life. There are so many issues around care, insurance coverage, employment, dependent care, and a host of other areas that most of us can't even imagine. Until we are there in such a predicament, planning for the future is made easier with help. So, what do we take from all this? We can't bury our heads in the sand, and that last slide was going to be, you were going to laugh right there. We can't bury our heads in the sand and pretend this isn't happening, and that it can never happen to us. I think it's best to think about advanced care planning now. even before a serious medical diagnosis. We can make a healthcare directive now for ourselves, before our circumstances require it, and that can be adjusted as necessary. These and other organizations are there to serve us in this area. So I apologize for being the one who has to break the rules and get off track, but thank you for paying attention, and that's it. Sorry about that.